Here we go, our first speaker, and the world of public services are absolutely packed full of brilliant human beings with an abundance, I think, of latent talent that can be unleashed to flourish and fly when nurtured with compassion and kindness. My life outside of PPMA is spent promoting love, kindness, and compassion in the workplace. So it's really, really great that I've got the opportunity to introduce to you our first speaker on the subject of compassionate leadership. You touch the lives of everybody in our local communities in some way every day. And our ability to influence for the better is unrivaled, I think, compared to any other aspect of public service. And the past 4 months have been the most extraordinary experience for us all. In a time of huge contrasts and extremes, for many there's been tragedy, and some of you will have witnessed this firsthand. For some, isolation, and for others, a time of positive reflection and growth. But throughout this, for me, the message of humanitarian compassion has really been a thread that's kind of guided us through this period, helping us come out of the dark times. So it feels really fitting to kick off this virtual conference with a world-respected thought leader in the space of compassionate leadership. So Professor Micheal West, Micheal is a senior fellow at King's Fund, London, and a professor of organizational psychology at Lancaster University. Micheal has led the NHS National Staff Survey development and implementation for 8 years and built an unparalleled evidence base around the subject of compassion. And he lectures worldwide in terms of what he believes can make the significant difference to people in the way that we lead and guide people. And so it gives me huge pleasure to introduce Micheal to you as our opening keynote speaker. If you've got any questions for Micheal, you can post them in our chat facility. And also, if you wish to, put your computer onto speaker view, and you've got an option there in terms of when you see the speaker view come up, and we're going to share screen, you can have the option of selecting a side-by-side. There's a drop-down panel that you will see, and it's quite straightforward. So click on View Options, it drops down, which will say side-by-side, and there's a little equal sign, kind of a vertical equal sign that you just stretch across. It all sounds a bit complicated, but I'll put the instructions in the chat facility, and then you'll just get the best experience of seeing Micheal and also the slides he's using. So with no further ado, Micheal, it gives me great privilege to introduce you as our opening keynote speaker. Over to you.
Thank you, Leatham, very much indeed. It's a privilege and a pleasure for me to have the opportunity to share some thoughts with you all this morning. So I'm going to wave to you. Can you see me? Good to see you. Hi there. So this has been a time of enormous tragedy. We've all felt fear, insecurity, and we continue to face difficulties in public services as we seek to navigate our way through these really difficult waters that are all over the world. And public services have been central to our ability to respond to this huge crisis. What we've seen, I think, is extraordinary innovation at scale and at pace. And you hear some examples today and tomorrow about those innovations that have been occurring in public services. We've also seen that people have changed the way they work dramatically. There's been a blurring of roles and a blurring of boundaries and a blurring of hierarchies as we've responded innovatively and flexibly to the challenges that we face. I think there's also in places been a greater emphasis on working together as teams in more supportive ways. People coming together in huddles, either virtually as we are doing here today, or face to face. Lots more camaraderie, celebrations, appreciations, as we seek to compensate for the, I guess, remoteness of this way of working together in many instances. And we've seen, I think, an outpouring of compassion from those working in public services to the people in their communities, compassion that staff in organizations have shown for each other, and compassion of the public for public services, for key workers, this huge outpouring of support, 700,000 volunteers to work in the NHS within the space of 36 hours. And it does seem to me that even before the pandemic, we were in a very dark place in terms of our public services in this country. Levels of stress were at the highest they'd ever been. Turnover, intention to quit, absenteeism were very high, and then the pandemic struck. So this has been a truly dark time, and I think now is the time, as Lethem said, when the light can come streaming in. And I think that for me, there are at least 3 important lessons that we can take from this period. Particularly the importance of compassion, the importance of working together in teams, and the importance of reflection, creating reflective space within which we can learn and innovate. So I want to begin by talking with you a little bit about compassion and the importance of compassion. And I'm going to share my screen with you so that you can see the slides that I've put together for this session this morning. That, if that's worked, Tracy, could you wave to me? Yay. Thank you. So what we've seen, I think, is, as I said, an outpouring of compassion. And I want to share with you some of the highlights very briefly from a review of all of the research literature on compassion in healthcare that was published in the United States last year by Tresiak and Mazzarelli, 2 doctors at senior level. But what they've shown is that compassion is the most important intervention there is in healthcare. So we see that in very careful, precise studies, and accumulated across many studies, we know now that when anaesthetists visit patients prior to surgery and are deliberately compassionate in their interactions, that results in patients being much calmer, as opposed to when they're given sedatives prior to surgery. They're drowsy but not calm. They actually feel very tense. And when that compassionate interaction is used, there's a 50% lower requirement for painkillers post-surgery, and people's length of stay in hospital is dramatically shorter. We know in studies of patients with an early diagnosis of terminal lung cancer that those who are randomly assigned to palliative care, early palliative care, extra compassion, live on average 30% longer. We see similar effects in long-term conditions like diabetes and HIV. And what we also see from this research is that, contrary to what clinicians think, compassion doesn't take any more time. And in fact, showing compassion has a significant impact on the well-being of clinicians. They have lower anxiety, lower distress, lower depression. And compassion is associated with cost savings. There's less need for future referrals. There are less repeat referrals. And the size of effects overall is greater than the effects of aspirin in heart attacks, and greater than the effect of statins in the risk of a 5-year cardiovascular event. And these are, I think, dramatic demonstrations, and they're but a small sample of what we've discovered. Compassion is the most important intervention there is in healthcare. And our neuroscience studies have shown us how there's a difference between being sympathetic and empathic and being compassionate. When we ask people to show empathy in response to somebody in distress, what we see is that the pain centers of the brain are typically activated because they're mirroring the other person's pain and distress. Yet when we ask people to show compassion, which has an important element of helping, that's associated with the reward centers in the brain. We feel good when we help others, when we show kindness practically. And I think that's because we're hardwired. We know that we're hardwired to be altruistic, to help others in distress. It's part of what enables us to bind together. Compassion has 4 key elements to it, key behaviors, if you like. If someone's in distress and I'm going to show compassion, first of all, I have to attend to them. I have to be present, as it were, psychologically. I have to use Nancy Klein's wonderful phrase, it's about listening with fascination. And second, I have to understand the causes of their distress, ideally through having a dialogue with them. And then I have to show empathy. I have to feel their distress at some level, because that gives me also the motivation for the 4th element of compassion, which is helping, practically helping or serving the other person in some way. So we know that compassion is profoundly important in human behavior. We also, I think, recognize that compassion is the core value of public services. When our welfare state was created in 1948, it was with a commitment by a post-war generation to ensure that everyone who needed help and support, regardless of their wealth, prestige, background, ethnic group, would have that help. So our society created a welfare state built on the core value of compassion. I think the challenge for us going forward in the future, and indeed now, of course, is how we create the conditions within our public services organizations where compassion is at the core, where those who work in public services are able to show compassion to those they serve. And that's the answer to that question, of course, is it's about the culture of our organizations. How do we shape culture? Well, culture is the interactions by every one of us every day in our organizations, how warm we are, how kind we are, how cynical we are, how irritable we are, how compassionate we are, how humorous we are. Every interaction by every one of us every day shapes the culture of our organizations. But the role of leader is particularly powerful. And what leaders pay attention to, what they talk about, what they monitor, what they model in their own behavior, tells people what it is that they value. So our leaders must model compassion in their leadership. And what that means in practice is those 4 behaviors. Leaders being present with those that they lead, paying attention to them, listening with fascination. Leaders who seek to understand the challenges that those they lead face. And people working in public services face enormous challenges and have done over the years. And I believe that the stress levels for people in public services, it's unsustainable and it's wrong. So leaders must also empathize with those they lead. And of course, that gives the motivation for leaders to take the 4th critical step for compassion, which is helping or serving the other. It's no coincidence that those 4 behaviors we know from the last 60 years of leadership research are the critically important 4 behaviors of effective leadership. Listening to those we lead, understanding the challenges they face, being emotionally intelligent in our interactions with them, and helping them do the jobs that they want to do by removing the obstacles which get in their way or ensuring they have the resources they need. It's no coincidence that those 4 behaviors are the same 4 behaviors that characterize compassion, because connection is fundamental to what it is to be human. Our need to belong is the most important driver for us beyond our basic biological needs. The need to feel connected. We're more likely to die from loneliness, the effects of loneliness, than we are from the effects of smoking or obesity. So compassionate leadership is about connecting and increasing that sense of belonging. But compassionate leadership is not soft cushions and scented candles. And there are some myths that people hold about compassionate leadership that I want to briefly address. We know very clearly that compassionate leadership takes much more courage than what I think is the opt-out of command and control, the easy opt-out of command and control. Compassionate leadership doesn't mean loss of commitment to purpose and performance, or it doesn't mean that performance management will be avoided. It doesn't mean taking the consensus way forward. Nelson Mandela did the opposite when he was released from Robben Island in 1990. He went against his followers to avoid a civil war and achieve a relatively peaceful biracial society without, well, through using negotiation and reconciliation and the Truth Commission. And it's also important to say, I think, that compassionate leadership requires courage, because compassionate leadership is also about being effective as a leader. So in public services, our leadership is about serving the needs of the people in our communities, so that our compassion is first and foremost for them. So that compassionate leadership requires that we're effective leaders, that we ensure there's clear direction, that we ensure that people's efforts are aligned around that direction rather than being dissipated on unnecessary activities, and we ensure that there is trust and motivation amongst those we lead. One of the characteristics, really tragic and harrowing, of this last few months has been our awareness of the disproportionate effect of the pandemic upon people from minority ethnic groups in the general public, as well as amongst our healthcare staff. And that's really thrown into sharp relief the pervasiveness of the effects of discrimination and racism in our society. The second point I want to make about this is that if leadership is not inclusive, it's not compassionate. And we have to strive as compassionate leaders to change the pattern of the last 60 years in public services to address issues fundamentally of equity, diversity, and inclusion in a way that really transforms the environment for everybody. And it's about collective leadership, where everyone feels they have leadership rights and responsibilities within our organization. People working in public services across the board are probably more motivated and in most cases far more skilled than almost any other sector in our society. We should be empowering, involving everybody in leadership, creating a sense of collective shared leadership. And shared leadership is the fourth area, the importance of working across boundaries. We've seen some amazing examples of health service staff going to work in care homes in the independent sector to support staff who are struggling with the epidemic. And I think it's also important to say that we know that compassionate leadership, those behaviors I described, are associated with positive outcomes in any area of industrial activity. If we look in the private sector, we know that compassionate leadership is associated with better service for customers, and that leads to profitability and productivity. In the NHS, as Latham said, we've been running this staff survey now for 15 years and getting responses from over 250,000 people a year. And what the data have unequivocally shown us is that staff views of their leaders affect patient satisfaction. Staff experience predicts patient satisfaction. Where staff report high work pressure, patients say that they're treated with less compassion, they're not given the privacy what they want, they're not treated with dignity. When staff report high levels of stress or poor well-being, we know, and I should say, by the way, that levels of staff stress in the NHS prior to the pandemic were at their highest levels ever. When staff report high levels of stress, subsequently care quality is significantly worse, patient satisfaction is significantly worse, financial performance of trust is significantly worse, and in the acute sector, patient mortality is significantly higher. So this is about performance and productivity, not just the moral case and the value case, if you like, for compassionate leadership. And part of compassionate leadership is understanding also what are the core needs of those we lead in the workplace. And we know now a good deal about human needs in the workplace, and in our work in health services, particularly in a recent review we did of well-being amongst doctors and a review we're publishing in a week's time into the well-being of nurses and midwives, we've used this framework of the ABC of core needs. We know that people need these three core needs to be met in their workplaces, and all three have to be met for people to have good well-being and high intrinsic motivation in their work. The first is the need for autonomy and control, that people must feel they have and must have influence and voice in their workplaces, rather than just being treated, as it were, as resources to be directed in whatever direction. They must feel that they work in just and fair cultures, and issues of inclusion and discrimination are key in that respect. And it's about creating environments where people feel that they're safe from being attacked and blamed and ridiculed. So creating psychological safety, learning cultures rather than blame cultures. People also have a profound need, as I said earlier, for belonging. And that's about creating relatively stable teams where people feel that they care for their colleagues, that they're cared for. And we've seen an enormous outpouring of love within teams during these last months. This is fundamental to human well-being. And we need to work in cultures that are compassionate and supportive, with leaders who model compassion and support. And the third area is the importance of competence or contribution. We want to be able to do a good job, particularly in public services, where we can make a difference to the well-being of our communities. And key to preventing that, I think, in public services is the problem of chronic excessive workload. When people are overwhelmed by workload, they don't feel they're able to do their jobs well or to provide the services that they wish to provide. And I think in public services, we've come to see chronic excessive workload as like a pattern on a wallpaper we no longer see. We have to address these issues. East London Foundation Trust does a regular review with its entire staff of what activities they need to get rid of that don't add value to the services they're providing, mental health and learning disability services. They've eliminated 85% of clinical audit activities, and yet they're still rated as outstanding by the Care Quality Commission. Using new technologies, change roles, more effective team working all contribute to reducing chronic excessive workload. And it's also about providing good, supportive, regular supervision for those we lead and ensuring their continued growth and development throughout their careers, training, learning and development, new challenges, varying opportunities, because we know that the need for growth and development is core to human well-being. And there are examples of public sector, public service organizations all around the country that we've seen innovating in this area and responding to the needs of those who've been providing public services during the pandemic. And the other theme that's been important during this period has been team working. And I've had the privilege of being involved in a lot of the work about supporting staff during team working in the NHS, and we've been particularly impressed by how people have been rebuilding their teams during this period. Team working is actually where all of this plays out. It's the team that people work in that has most influence on their well-being, their motivation, their effectiveness, their feelings of belonging. And during the pandemic, we have been recommending to NHS staff a focus on rebuilding their teams as we move through the pandemic, embracing new ways of working rather than reverting back to where we were, which was intolerable for staff, reuniting around a core shared purpose with clear, limited number of goals and objectives that ensure focus. Taking time out to reflect, I'll say more about this, valuing diversity and managing conflict positively. We know that in well-functioning teams, diversity is an asset. Diverse teams are much more productive and much more innovative when they have clear objectives and a compassionate culture. And it's about, as I said, promoting belonging and celebrating success. When people are under enormous pressure, the tendency is, I think, to spin the hamster wheel ever faster, to revert to command and control. We began looking at this problem back in the 1990s, I and a number of researchers. And what we found consistently over the years, and I think this is a general truth, is that teams that take time out to review, to debrief, to have meetings to reflect, we know are much more productive and much more innovative. It's true of us as individuals. I think during the pandemic, when we've taken time out in nature to be still, to reflect, it's helped us to cope with the challenges. And we've seen so many more people out in the natural environment, those who are able to access parks and the countryside have done so in increasing numbers because of the connection and the stillness that gives us. The same we find is true of teams. Teams that take time out to review and reflect are much more productive and much more innovative. And in fact, in a recent review of 49 separate published studies of debriefs, reviews, after action reviews in teams, the data shows that teams that do that are on average between an astonishing 35 and 40% more productive than teams that don't. And we found the same in organizations across public services and indeed private sector. Organizations that reflect, that take time to be still and review are more productive and innovative. And we've seen that too in practices at the individual level like mindfulness and meditation, which have helped people to cope and be more productive and innovative. So there's a deep lesson of learning there, I think. And to summarize what I've been saying, I think it's about how we in the public services create psychological safety for our staff. Through effective team working and compassionate leadership, we create trust and innovation and a feeling of safety. It's what we as humans need to feel, and particularly during these hugely difficult times. It's about having a clear shared vision, a set of values, and a limited number of clear goals at every level, for every team, for every organization in our work, of taking time out to review, to reflect, to have huddles, to learn and to innovate. It's about having frequent positive contact with each other. And I know that's been difficult during this pandemic, but even using these video conferencing techniques to see each other's faces, to take time to connect with each other about what we did at the weekend, how the family are, increase that sense of belonging. It's about valuing diversity. The universe is diverse. Our planet is diverse. There's a diversity of species, of birds, of flowers, of planets, in the cosmos. Diversity is the nature of the universe, and we humans, I think, must come to see diversity as positive and value all difference. And it's about mutual support and compassion and humility that creates a climate of psychological safety rather than narcissism and competitiveness. It's reaching out across boundaries to support each other in public services, across team boundaries, across organization boundaries, across sector boundaries, always asking the question, how can we help you? But in order to have the capacity and the resilience to model this compassionate leadership, I think it's really important as leaders that we first practice self-compassion. And perhaps this is the most difficult challenge, to pay attention to ourselves, to understand the challenges we face in our work and in our lives generally, and to care for ourselves, to empathize with ourselves, and take intelligent action to help ourselves in order that we can be the best leaders, the best human, the people we can be, and stay close to the core values that give our lives meaning, like compassion, so that we are then able to have deeper and more authentic connections with all of those we lead, indeed all of those we interact with. So it begins, I think, with a commitment to deep self-compassion. So thank you for listening.
Michael, thank you so much for a really brilliant session. I can't think of a better way to open this conference and hearing your message. I mean, I never fail to be moved by the message that you share, however often I hear it. And there's certainly something in terms of the current climate that has generated an interest here. And today we've got Lynette Whitaker, who's in conference audience. And Lynette and her colleagues put together a session on compassionate leadership for the OD network in London councils. And there we had over 600 people join that session, where we were talking about compassionate leadership. So there's definitely an interest there, but what is it that you think is preventing organizations from embracing this so kind of wholeheartedly? Because this work and this message that you've got is something that you've been promoting for a number of years. And yet at the beginning of your talk, you were saying that the levels of well-being have been probably the lowest in public sector than they've ever been. So what is it that we need to do as an HR community to start shifting this debate and dialogue into positive action in this space?
So it's a really important question, and I think that what we're seeing in the health service now is, across our health service, which is the biggest employer, of course, in the UK, is a commitment by all 4 UK health services to the development of compassionate leadership. So the new people plan in the NHS has a central commitment to developing compassionate and inclusive leadership and compassionate and inclusive cultures. That's reflected also, mirrored also, in the 10-year strategy of NHS Wales for developing compassionate leadership across the system, also in Northern Ireland's collective and compassionate leadership for health and care, and also in Scotland in its Project Lift, practical intervention to promote collective and compassionate leadership across the system, actually for the whole of Scottish Government. So there are really, I think, positive signs, and those, I think, are a consequence of the fact that our health services were in a situation where they had to act because of the high levels of turnover and staff stress and absenteeism. I think what's important is to keep persistently presenting the evidence about the links between this way of leading and outcomes. And I think also to reinforce the fact that it's been compassionate leadership during this pandemic which has enabled us to cope and has helped us to recognize that by freeing people and supporting them, we release the innovation which is so central in a crisis and actually is fundamental to our ability to deliver high quality care services. So I think I would say 2 things. One is we have to repeat these messages at every level within our organizations, but it's also important that each of us takes responsibility for letting the light come streaming in as we go forward and modeling this way of leading and working together in our organizations.
Yeah, it's really great advice. And the document you referred to, which has just been published by the NHS, we'll get a link to that for members. It's really well worth reading. And the message in there is such a powerful one, that we can all learn from. The way it's presented, it was a really heartening read and very positive. And kind of one last question from me before we kind of end the session. So we are a community of HR leaders and influencers in our organization. And certainly when I speak to people, the kind of language of love, kindness, and compassion is something which can quite easily be dismissed, particularly when I'm engaging with chief executives of that executive board. How do you actually make it something which is meaningful? I mean, I would say the book you referred to Compassionomics is a brilliant book, and it's got loads of really fantastic data in there, which actually demonstrates the worthwhileness and worthiness of this kind of work. As you say, it's not about cushions and lighting scented candles. It's really hard data and evidence-based to actually back it up. But kind of how do you get people to engage with this language, the use of the words such as compassion and kindness? How do we do that as HR professionals?
So I think the community of HR professionals and OD professionals that is itself a social movement, as the Greens and the feminists have been over the years. And we know that when such movements speak with one voice and have 4 or 5 clear messages that they repeat and repeat and repeat, that they open up the thinking of those around them and lead people to think more creatively around the issues. So PPMA is a hugely important social movement if it commits to a set of messages that are repeated in every area of our public services over time in a consistent way. That will profoundly change, I think, the climate we find ourselves in. And that takes, I think, courage and mutual support. And also, as you say, what we have is the backing of the data in many areas. There's the work of Tresiak and Mazzarelli that you mentioned. There's the work we've done in health services over the years and many other researchers in public services. So I think it's about also using the message. And as I said before, I think that each of us as individuals, the way we live is itself a powerful message for those around us. If we influence our own teams to behave in supportive, compassionate, courageous ways, then we make a profound difference. And I do think fundamentally that begins with self-compassion, that by connecting deeply with ourselves, however we do that, through meditation, through being in nature, and most importantly, through spending quality time with our loved ones, the more we take care of ourselves and develop self-compassion, the more able are we to connect with all of those around us and model that compassion that our world, our human world, desperately needs.
Michael, thank you so much for joining us. A great way to end with that message of self-compassion. And for everybody out there who's not aware, PPMA have been running since kind of mid-March, daily mindful practices, really focusing on this whole concept of self-compassion. So tomorrow, if you want to experience that and you haven't joined one of these events, it's there for all conference delegates. So check in. The theme tomorrow is all about self-compassion, love and kindness. And it'll be great to see you there at 8:30. And we look forward to seeing what kind of movement we can create, because as Michael said, this is about a movement, coming together as a community and finding that voice to start influencing together, because together we will have the ability to change and transform the way people feel and experience their lived experience on a day-to-day basis. So I look forward to seeing how that morphs and develops over time. And Michael, you're always very welcome back at any point to inspire us as you've done this morning. So a huge virtual round of applause from us all to you. And thank you so much.
Thank you. It was a privilege and pleasure for me. Thank you all very much. Have a great conference.
Thank you so much.
Thank you.
So everybody out there, that's the end of our first session. And we will provide you with links to the work of Michael. I mean, his research work is really powerful. It's very profound. It's based over many years of data, to kind of get traction in terms of this subject. And it's worth checking in. There's great videos as well in terms of providing with a little bit more kind of background in terms of the message that he's been sharing.